Good morning, friends and family. It's July 21st, 2025, and it's another rainy, cloudy day here in the old Pueblo, my favorite type of weather. Even if I'm completely depressed and I wake up and I look outside and it's cloudy, I become happy. I always wonder why I didn't end up in a place like Portland or Seattle. I just came from getting my hair cut. That feels good. I am back in the grind. Started summer session 2 at the U of A this week, or last week. Had a bunch of reading to do and a paper and discussion response all due last week, and that is actually a source of joy. Keeps my mind occupied, keeps me from worrying about things that I have no control of. I've also been, even though I ruptured a tendon pulley in my right hand, I did manage to get to the gym a couple times, the climbing gym a couple times last week. I made it to Yoga Oasis a couple times last week, and I rode my my Wahoo trainer every other day, or every day that I wasn't participating in yoga or climbing. I'm not yet back on the weights because I injured my shoulder back in February, and I'm hesitant to start weight training again. I'm gonna wait until I get back to school and have my friend and coach Tank Miles help me formulate a plan to help me get back in the swing of things regarding weight training. They call him Tank because he is like a tank. He's the D-line coach of the football team, and he's 36 years old. He comes from New Orleans, and he is one of my favorite people on campus. So I'm actually really looking forward to getting back to school so that I can see him and some other people who mean so much to me. I talked to Coach Rios this week about what's going to happen the first week of school, to make a plan, because I'm not going to be there most of that. That being said, it was just really good to hear her voice, and I am so lucky to be where I'm at with the people that I'm surrounded by, from the administration to the faculty to the students. I feel the love, and it's easy for me to give the love in return. It is a community and like a family, which is exactly what I was looking for whenever I set out to find my home as a teacher. So again, I feel like I'm on my path, that God or the universe has me right where it or he wants me to be. Although I have profound uncertainty in my life right now that causes me a great amount of suffering. I say all of that to say this. August 5th through August 13th, I am going to MD Anderson in Houston. I'm flying out early in the morning on the 5th, and I'll come back on the 13th. They're doing a full barrage of scans, MRI, CT scan, blood work, all types of labs. And all of that is because I found another trial that I'm hoping to get into, that is being led by Dr. Van Morris, who was leading the trial that I initially wanted to get into earlier this summer, but that was closed. Interestingly enough, if you give people who have circulating tumor DNA in their blood, if you give them chemo, it doesn't eradicate it, which is counterintuitive and exactly what I wanted. I wanted my oncologist here in Tucson to just give me a dose of chemo, or maybe a 6-month regimen, and perhaps wipe that minimal residual disease out. But turns out my doctor was right, and he knew what I didn't know, that line of therapy was ineffective. I still don't quite understand how that can be, considering that 6 months earlier, if I had been staged any higher or had any more risks that came back from the pathology, I would have been given adjuvant chemotherapy to do just that, to eradicate cancer cells that might be remaining after surgery. So, all right, so I'll just admit I don't understand why 6 months later giving chemotherapy to someone with circulating tumor DNA or minimal residual disease doesn't work, but I accept it as truth, and moving on from here. So the new study is an immunotherapy monoclonal antibody that is supposed to activate T cells to go in there and attack any tumor that may be present or minimal residual disease that may be present in my blood. I am somewhat excited about this prospect, but after all that I've been through, I am hesitant to let my hopes play too much of a role in my outlook. I have learned to have a positive outlook, but I remain cautiously optimistic. I simply can't handle further bad news or disappointment that I find to be devastating over and over again, repeatedly. So with that approach and that being said, I move forward. I still don't know what's going to happen. That uncertainty creates a lot of anxiety and stress. At this point, I don't have anything or any active cancer showing up on any scans, but the positive Signatera test is supposed to be a strong indicator of that possibility, and with that would come a restaging, and it would mean that the stage 1 cancer that was localized in my colon that they removed has somehow metastasized. And I'll wrap this up by saying if that's the case, what I know now indicates that metastasis would not be widespread. It would be what's called oligometastatic disease, which would mean 5 or less tumors, and the overall chances of survival are much greater when that is the case. So that gives me some hope. It's still very scary. It's hard to see myself having a future or making plans for things that I may or may not want to do, because it's hard for me to visualize myself being alive 5 years from now. And I know that may sound morbid or negative or pessimistic, but until I know more, I am forced to face the reality that that there may be metastasis, and I know the statistics that come with that aren't encouraging, to say the least. That being said, my doctor has talked with me about statistics, and I am an individual. I am not a statistic. I posted something on here earlier about the median is not the message by Dr. Andrew Gould, and that's something that I read over and over again to help me maintain perspective. If you don't know what I mean, I encourage you to take a look at that. I know for a fact that I am on the right side of the curve. I'm young. I exercise 7 days a week. I eat better than anybody I know. Not only that, I eat a diet that is informed by the vast majority of research there as it relates to food and the types of foods and supplements even that are cancer fighting, from preventing blood vessel creation and blood flow to tumors, to antioxidants, to actual enhancement or building of a more robust immune system that activates T cells and natural killer cells to go out and destroy cancer cells and tumors in the body. So I am active. My nutrition is on point. I am meditating. My mind is it could be better, but it's where it needs to be. For now, I'm working on that. I do believe that my mind and my attitude play the most important role, are the most important factor in my survival. Next to my level of activity, which I said is 7 days a week. I mentioned I mix it up between climbing and eventually weights again, but climbing and yoga and mountain biking, and then my diet. So I see myself as already on the right side of the curve regarding overall survival, and that's all I can do. That's all I have control over. I'm lonely. That's something that I'm working on, developing my community, being open to new people coming into my life. I've got my son, I've got my friends, and again, I am cautiously optimistic. Even if this trial doesn't work out, MD Anderson has a large, vast portfolio of trials, And even though I'll probably continue to work with my my doctor here in Tucson at the University of Arizona Cancer Center, who has done nothing wrong, I trust him with all of my care. I just at this point need to extend or expand my my healthcare team, and MD Anderson is the #1 cancer hospital in the world. So that's a no-brainer. I may need help at some point raising money for trips to go back and forth, but I will deal with that or cross that bridge when I get there. Again, the most important thing in life is love, and fear is something that actually suppresses our immune systems, actually can create and cause and create disease, stress hormones, inflammation. These are all things that may be occurring in life without you knowing, or without you being aware of it. So I encourage you to read up, to pay attention, to do whatever you can to make sure you're not living in anger or in a depressed state, in a state of anxiety, in a state of worry. I encourage you to be active. The older you get, the more active you need to become. I encourage you to, again, I should have said this first, but the #1 priority is focusing on your mind and creating a mindset that allows your body to thrive and allows your immune system and your biology and physiology to work in your favor and to ward off disease. The second thing is your level of activity. My oncologist told me that 5 days a week of moderate intensity, moderate level of intensity activity can decrease your chance of getting cancer or reduce your chance of a recurrence by 40%. And lastly, our diets. We are what we eat. You know, Hippocrates said, "Food is thy medicine. Let medicine be thy food." And that is the truth. We are what we eat. And I encourage all of you to look into that, because again, I was vegan since I was 25 and I still got colon cancer, and I thought my diet was superior to anybody that I knew. And when I learned all that I've learned over the last year, it was a real jagged, hard little pill to swallow when I realized that a lot of the stuff that I was eating on a daily basis was promoting disease, and was not as healthy for me as I thought it was. So lastly, and to try and thread this thought back together, life is about love, and whether we're facing cancer or cancer recurrence or heart disease or old age and our mortality, we're dealing with relationships that are blessings, but then without our being aware of what's happening, soon turn into or fall apart, or turn into something that is unhealthy. Whether we're dealing with children that have problems or issues or health issues, our job, our families, there are so many things going on in life that cause stress and worry and fear, and it's so hard to maintain a loving, compassionate outlook or approach to life. And that's where I'm at. I started this journey a long time ago as a person who did what I had to do to fill my cup, to be a vessel of love and to pour myself out on the world around me. And at a certain point I was derailed. I've talked a little bit about that, but you know, I'm gonna spend the rest of my life, what little amount or large amount of time that I have left, I'm gonna spend loving myself and the people around me, and that's all that you can do. That's the most important thing that you can do. Love is that mental component that is like a panacea. It's like a cure-all. It helps bring everything, all of your priorities in line, and it guides you and illuminates the path forward, and shows you how to live, and where to place one foot in front of the other. Fear is not the way. Anxiety is not the way. Doubt is not the way. And these are the things that we have control of: our mind, our bodies, how we engage in activity, and our diets and what we eat. And so all that being said, again, I'm going to MD Anderson the first week of August. I'm going to have all of the tests and scans that you can imagine. They want all their own blood work. They want all of their own imaging. And I am hoping to get into this trial. But if not, it'll be nice to get a second opinion, and we'll go from there. All right, I'll keep you posted. Love you all. I'm blessed to be in Tucson. I have a lot of friends and family. I haven't been the best friends or family member. I was lost for a long time in my own dysfunction, dealing with childhood trauma that I didn't understand, dealing with the trauma of relationships that I was in that I didn't understand, and I feel that I am just grateful that I am on a path to healing, and I hope that you are also happy and healthy. And if you're not, I hope you're also on a path to health and happiness and healing. All that being said, much love, and I will see you all soon with another update. Take care.